Okay, so now I'm going to be discussing endometriosis. So there's a lot of controversy out there whether endometriosis is considered an autoimmune disease or not. I believe it is, but what it is the lining inside your uterus grows outside of your uterus onto other organs of your body. And most of the time women present with extremely painful periods, or we call it dysmenorrhea. You can also have a lot of clotting when you're having periods, so dark clots, a lot of lower back pain, pain with intercourse. Those would be the biggest issues. Some women might even present with breathing issues. Sometimes the endometrial tissue can get all the way to the lungs. So it's something pretty serious, and unfortunately, the only way to diagnose endometriosis is having surgery. So that's unfortunate. I highly recommend, if you do have surgery, to find someone who specializes in excision surgery. So basically, that's different than your typical laparoscopic surgery, where it's called ablation, where they just burn the top of the endometriosis. With excision, they actually go down to the root and pull it out. So it takes a lot longer for the endometriosis to grow back. There is a Facebook group called Nancy's Nook, and that is the best way to find a doctor near you that's qualified. So with endometriosis, the problem is having high estrogen. So that's what's causing the clotting. So lowering your estrogen is a good way to start. Some things that you can take are DIM, but I always think it's good to test because not every woman needs DIM. A lot of the times it could be caused by retrograde bleeding. So a lot of the times instead of the blood leaving your uterus, it actually comes back into you. So, it's good to test out. Even a lot of women can have pelvic pain, so seeing a pelvic floor therapist will help. And just doing a lot of things that decreases inflammation. So taking turmeric or curcumin is very anti-inflammatory. Women with a lot of painful periods and endometriosis have a lot of prostaglandins, which causes the pain. So things such as fish oil helps to decrease your prostaglandins. There's a lot more to do. Lowering the intake of red meat can also really help. But those are a few of the things that I recommend. Taking melatonin is also, which is an antioxidant, which is your sleep hormone, but that's also shown to help decrease pain. So those would be the biggest things. And I wish you well. And if you have endometriosis, I'm sorry. But there are ways to manage it and get pregnant and have a healthy future. So